Hello, listeners. Welcome again on Health Issues Podcast, a podcast where we discuss medical conditions that we came across in each and everyday life. In this program, you are with me, Livinus Mtioga, and our guest is Dr. Josam from Mulanje District Hospital. Welcome, Mr. Josam. Today, Mr. Josam will be taking us through Hepatitis B. You are with me, Livy, and the editor of this program. Mr. Josam, you are welcome in this program.
Thank you very much.
Okay, Mr. Josam, can you tell us the overview of hepatitis B?
Hepatitis B is a viral infection. But before I dwell much on hepatitis B, I just want to give you an overview of hepatitis. Because when you say hepatitis B on its own is a condition. However, hepatitis by definition is inflammation of the liver.
Okay.
When the liver is inflamed, we term it as hepatitis. There are four types of hepatitis. We have got hepatitis A, hepatitis B, hepatitis E, hepatitis C, and hepatitis D. But in Malawi, most of the time we dwell much on hepatitis B, which is more of public importance, although we might encounter other types of hepatitis C and D, which is not much more important because they are self-limiting. So each and every viral infection is self-limiting, but it just depends on the phase of it. So that is just an overview of what's all about the hepatitis. So dwelling much on hepatitis B, as I have said, that hepatitis on its own is a viral infection, which much more it deals with the liver. It makes the liver to get inflamed. So hepatitis B, again, is the one which causes the liver to get inflamed, and in this case it affects the liver. There are various ways on how this infection can be transmitted, treated, prevented, and other things. So as we go along, we'll be discussing all those kind of areas on what about hepatitis B is concerned.
All right, Mr. Josam. Now, what are the causes of hepatitis B?
Hepatitis B virus most of the time is caused by viral infection. So the virus that causes this one is a virus by the disease. It's a virus of nature. There's no specific that this virus has got its name, but it is a virus that carries this infection and attacks the liver. That's all about what the theory about hepatitis B virus is concerned. Although they say that it's a DNA particle of a virus in nature. That virus is a DNA particle. That means it's a very dangerous one. That's what we can say about the causative agent of hepatitis B. Yes.
Okay, it seems that this hepatitis is also a dangerous disease. Is this virus you're saying here related to HIV? Because I've heard someone saying that hepatitis is just the same as HIV. I don't know. I think we all know here, because you're here to teach us, Mr. Josam. Is it the same?
These conditions are very different. Hepatitis B is a viral infection. Even HIV is a viral infection as well, but they attack the different organs.
Okay.
Hepatitis B, as I said, it attacks the liver.
Yes.
While HIV/AIDS, it can massacre any other organ, liver, kidney, brain, whatever, whichever. It can attack each and any system of a human being. While this one is much more specific on the liver.
All right. So, are there any risk factors or say transmission? How can this disease be transmitted? Can it be transmitted from one person to the other? How?
This infection, Hepatitis B, is very interesting. It can be transmitted through different ways. Number one is blood-to-blood contacts. When you have got in contact with a blood that has got a viral particles of hepatitis, the chances of getting the infection is very high, especially if you have got an entry point. In this case, we know that our hands or each and every part of us, the skin has got pores. The chances of getting infected when you are in contact with the blood matters. Even sweat, you can easily get. You have got the chances of catching this hepatitis B. Another thing is sexual transmission. Sexual transmission, in this case, we are talking of unprotected sex. Unprotected sex shall entirely merge on where you have got entry point. Each and every disease, for it to happen, there must be a port of entry. The first thing, it has to enter in the blood system. When it enters, then it does its pathophysiology and the disease results. Now this hepatitis B, when it has entered, when it has got found an entry point, the chances of transmission is very high. Another transmission factor or risk factor is mother-to-child transmission during birth, even during birth or even intrapartum. Intrapartum shall imply that when the mother is pregnant or postpartum. Postpartum shall mean that after birth or during birth, when the mother is giving the birth. All these factors can result into transmission of hepatitis B. How does this happen? When the mom is pregnant, there is transmission of fluids from the child to the mother or mother to child through the placenta. So when the mother has got the viral infection, the likelihood of giving you the baby is very high.
Okay, hepatitis B seems to be a very serious condition. Mr. Joseph is saying that even the fluids, the sweat, once you touch your friend, you sweat, then you're at risk of getting this disease, this condition. All right, Mr. Joseph. So, are there any signs and symptoms of this disease?
Yeah, each and every disease has got a sign and symptom. In this case, we are talking of hepatitis B. Hepatitis, as I said, inflammation of the liver. So, in the liver is where out of process, body process, they take place in the liver. Metabolism, anabolism, catabolism, whatever reactions takes place in the liver. So, the first marker to be spotted that this patient might have hepatitis, it is jaundice. Jaundice can be described as yellowing of skin and eyes. The eyes and the skin became very yellowish. That shall imply that the liver is being undergoing inflammation, whereby the other cells in the liver are being burst open and liberating what we call the pigment, yellow pigment of the RBC, and that yellow pigment is the one that causes the liver, or rather the discoloration, to take place in the organ that I have mentioned. Another clinical sign is vomiting. Much as vomiting and nausea. Nausea is an urge to have the vomit, while vomit actually is the actual liberating things from the GIT. So, in actual sense, what happened there is like there is a entourage of the foreign body in the body, the vomiting centers are being triggered. When these have been triggered, it results into the this patient might experience some vomiting because the vomiting centers have been triggered. Since there's vomiting and the likelihood of having loss of appetite, which we call it anorexia, is very high as well. Because when an individual is experiencing the urge to vomit, you cannot have a very good appetite. So that loss of appetite will result into fatigue. Since you are not taking a lot of meals, the meal that you are supposed to take in the normal circumstances, so you are likely to be very weak individual. In this case, we are calling it as a general fatigue. So the fatigue comes because your appetite is low, you are not taking your meals as you are supposed to take. As such, the fatigue is being experienced. In addition to that, there's abdominal pains. Abdominal pains comes because, again, for the reason of sensation of immune system. Immune system in all other systems of the body, like in this case we are talking of the gastrointestinal system. It gets sensed and result into nothing but liberation of antibodies against this foreign body. In this case, we are talking of the virus that causes the hepatitis B as a disease. In severe cases, we have got dark urine. Dark urine comes, as I said, that this condition much more attacks the liver. So the liver is where a lot of process takes place. So in reaction, the liver, they tend to break other cells. Those cells, the remnant one, they're being liberated, being excreted via the genitourinary system, that is through the kidney. So the kidney, instead of purifying a very good purified urine, since the cells are a lot of them, it's like it is processing contaminated thing, and no wonder we experience dark urine as if we are dehydrated.
Okay. I also come across with people discussing that this hepatitis B is a disease that if someone is diagnosed with it, he will not stay long. Is this true? They're saying that you can't stay long if you are diagnosed with hepatitis. Can you clarify on that?
Every disease has got its own issues of staying long or not staying long, depending on how that disease has presented itself in the body system. How it has presented in the individual's body system, or how the body system has reacted to the condition. In terms of hepatitis, as we were talking about the overview, we said that hepatitis is a viral infection, has got the types, and we forgot the alcoholic hepatitis. Alcoholic hepatitis is hepatitis that is caused by alcohol consumption, and it is short term. In that case, if we say short term is like acute hepatitis, that take it as a types of hepatitis B. In hepatitis B, we are talking about the acute hepatitis B, that is short term.